Hi, this is Dr. Chad Larson. Thanks for joining me in another episode of Keep It Real. So today we're going to talk about something for the men. I'm oftentimes asked by men if there's any natural therapy for prostate issues. And so the prostate gland is a little gland that's involved in sexual function and reproductive function. And like many glands in the body, it's vulnerable to problems. It's vulnerable to dysregulation and issues. And so oftentimes what happens in men is something called prostate enlargement. Other names are prostate hypertrophy or prostatic hyperplasia. So basically it's swelling of the prostate. There is something called, something called prostatitis. Prostatitis is more of like an infection type problem in the prostate. That's a separate issue that usually has to be treated with antibiotics or something like that. But what I'm talking about today is a much more common issue, and it's swelling or hypertrophy of the prostate or enlarged prostate. And there's a variety of reasons why this happens, but oftentimes men, there's a couple of medications that can be used for this that a lot of men don't want to take because they have other side effects that they don't want to have. And so they oftentimes ask us for natural therapies for enlarged prostate. And so when you start looking, at nutrition stores and looking at products with for prostate support, there's a few plant-based ingredients or botanicals that you oftentimes see. So I thought today I would show you a label of one and just from an education standpoint, talk about some common ingredients and why they're in there and how they could effectively support healthy prostate function. And so there's a few things. Let's just talk about how the prostate works and what kind of imbalances could lead to this type of prostate enlargement. And basically, it's usually some kind of hormone dysregulation. And what I mean by that is, obviously men have testosterone, or they should have normal amounts of testosterone, but then testosterone has to be metabolized. And metabolized testosterone could influence the way that the prostate functions, because there's healthy ways that that testosterone and other hormones can be metabolized, and then there's unhealthy ways. So one of the ways that would be unhealthy if it goes a little bit excessive is testosterone gets converted into DHT or dihydrotestosterone. And some dihydrotestosterone is perfectly healthy and normal and good for the body, but too much DHT can cause dysregulation or swelling or enlargement of the prostate. Other issues where, like, testosterone can also get converted via an enzyme called aromatase into estrogen, and estrogen in excessive amounts in men could also be a problem. So we want testosterone to be in normal range, but we also want DHT and estrogen to also be in normal range. And although estrogen is more commonly known as a female hormone, men need some estrogen in much smaller amounts, but a little bit is necessary as well. So it's the balance that we're talking about. So there's some botanicals that have been used for prostate support for a long time, and so I thought I'd mention a little bit. With that kind of hormonal summary as a backdrop, we'll talk a little bit about how the prostate works. And how these botanicals work for the prostate. So first I'll just mention there's this product. It's called Saw Palmetto Plus. And so saw palmetto is one of those botanicals that I'll mention. And here you can see the ingredient label. Hopefully that comes in somewhat focus. And you'll see saw palmetto, and you'll see pygium, and then you'll see pumpkin seed oil, and then you'll see nettles. So those four botanicals are very commonly seen in prostate products like this one. And there's different quality of these botanicals, of course. And this particular company, this is a very high quality form of these botanicals, because you want to see that these botanicals are standardized to a certain level of the active ingredient. And good companies like this one is one that gives you that standardization, because that's what tells you that you're really getting the medicinal value of each of those botanicals. So let's take two to talk about saw palmetto and nettles. Sometimes you'll see nettles on the label as stinging nettles. And saw palmetto and stinging nettles work by influencing or modulating the effect of those enzymes. Remember, there's enzymes that convert testosterone into DHT. That's called 5-alpha reductase. That's the enzyme. And then there's an enzyme that converts testosterone into estrogen, and that's called aromatase. And so these botanicals have been shown to influence the function of these enzymes in a positive way. So in other words, by striking that proper hormonal balance, by modulating the activity of those enzymes, then that has a really positive effect. There's been lots of cool clinical studies that have been done, and they've shown clearly over multiple types of studies with lots of men with prostate issues that it increases urine flow. And the reason why that's a good outcome to measure is because when the prostate enlarges, there's a tube called the urethra that goes through the prostate, and if the prostate is swollen, it kind of clamps down on that tube, and decreased urine flow is one of the really key symptoms of prostate enlargement. So by increasing urine flow outcome, that's a really good measurement that something's working. And saw palmetto nettles have clearly been shown to be helpful in that regard. And then there's two other botanicals in there. One of them is pumpkin seed oil. And the reason why you oftentimes see pumpkin seed oil is because a couple things. One's pumpkin seed oil is rich in certain essential fatty acids. And these essential fatty acids are very anti-inflammatory. They kind of boost up your body's own natural anti-inflammatory system. And we know that swollen prostate or prostate enlargement is largely an inflammatory issue for the prostate. So these are helpful anti-inflammatories. Also, it's rich in zinc. Pumpkin seeds and pumpkin seed oil is rich in zinc. And zinc is a very important mineral. It's found very abundantly in the prostate, and it's there because it has multiple functions, but at the very least it's works like an antioxidant. So we want to decrease oxidation to the prostate, and that has a sort of anti-inflammatory effect on the prostate as well. So that's pumpkin seed oil. And then pygeum is another botanical that does a couple things. It helps to balance a hormone called prolactin, which can influence the health of the prostate. It also helps to balance our prostaglandins. And prostaglandins, just think of, again, like from an inflammatory standpoint, there are certain inflammatory prostaglandins, and then there are anti-inflammatory prostaglandins. And this pygeum has been shown to sort of target the prostate and support the prostaglandins locally in the prostate. So it has an anti-inflammatory effect. So these kind of botanicals, like we just talked about from this product, help to balance the enzymes associated with healthy hormone metabolism, and they help to support basically inflammation. So it's a good product. There's really good studies behind these, and so just something to think about. I just wanted to kind of highlight that product, and always what I'm trying to do is help educate you so that when you look at nutritional supplements, you can read the label with some understanding, really know what you're reading. So I hope that was helpful, and we'll talk to you next time. Until then, keep it real.